morning, everyone. Thank you so much for joining us for this Justice for Breakfast Language Access as a Human Right. I'm going to pass things to our interim co-executive director, Kathleen Gregory.
Good morning. Thank you so much for joining us. We are excited to see so many people here to talk about language access as a human right. I'm Kathleen Gregory. I'm the interim co-executive director for the Public Justice Center. The Public Justice Center is a nonprofit organization that pursues systemic change to build a just society. We use legal advocacy tools to pursue social justice, economic and race equity, and fundamental human rights. The Health and Benefits Equity Project is one of 7 areas where we do legal advocacy. Others focus on advocating with and on behalf of low-wage workers, low-income tenants, and students facing exclusionary school discipline, using appellate cases to establish good law in poverty and civil rights cases, and coordinating a national coalition that works to establish a right to counsel in basic human needs civil cases. The Health and Benefits Equity Project advocates to expand and protect access to healthcare and safety net services for Marylanders struggling to make ends meet. We support policies and practices that are designed to eliminate racial and ethnic inequities and enable every Marylander to attain their highest level of health. Language access is one of those priorities, and I'm going to hand it back to Ashley and the Health and Benefits Equity team to introduce themselves.
Yes, thank you. So my name is Ashley Woolard, pronoun she, her. I'm the lead attorney for our Health and Benefits Equity Project, which you've already heard about, so I won't do the introduction, but I'm going to also introduce my colleague, David. David, did you want to introduce yourself, actually?
Sure. Good morning, everybody. I'm David Reische, and I'm a paralegal with Ashley at the Health and Benefits Equity Project.
Great. And we have another team member as well, who's on 2 different teams at PJC. So half on the Workplace Justice Project, and then our project, Sam Williamson, who's an attorney, pronouns they, them. So today we're going to be talking about language access. Like I said, language access is simply, as I can put it, is the right to understand what's being communicated to you, and the ability to be able to communicate that back without this gap, without the barrier of language, without language being a barrier. Life without being able to understand vital information that's given to you would be impossible. How would you make decisions? How would you let someone know that you need help? How would you know whether your rights are being violated? It can feel like crisis after crisis is just happening to you when you don't know what's going on around you. And no one should have to go to a family member, a friend, or a neighbor that speaks English to be able to understand what's being communicated to them, particularly by a state agency, a healthcare provider, or really anyone else that's receiving funding from the federal government that's obligated to make those communications accessible to everyone. That's why this morning's presentation and strategic advocacy brainstorming session are so important, because we do have some significant changes happening on the federal level. We've also got some exciting changes happening here in Maryland. Although this presentation, we are going to use Maryland as a case study and focus in on Maryland, but we're also going to be talking more broadly about language access strategies, advocacy strategies, and information that can be used anywhere in the United States. So with that said, just a few housekeeping matters. So one, this meeting, as you can see, is being recorded and will be shared at the after the presentation ends. Usually we will send a thank you email with the presentation and any slides. The slides will also be shared a day or two after the Justice for Breakfast. 2, if you have any questions, comments, feedback for us that we don't get to during this presentation and during the discussion, please reach out to me directly. I'll send my contact information in our follow-up email. And then 3, we want to keep this as a respectful, safe solidarity space. So any isms like racism, sexism, any obias like transphobia, trying to think of other obias, but you know what I mean, are not allowed in this space, and you will be booted from the meeting if we hear any of that. And then the last thing I wanted to say is that we are a 501c3. We're an advocacy organization. We can do legislative and policy advocacy along with our legal work like direct representation, administrative advocacy. What we can't do, because we are not a 501c4, is something called electioneering. So we can't, publicly, other than in our personal lives, can't in our workspace support or endorse particular candidates. Today, we are going to be talking about the incoming federal administration, the Trump administration, but we're going to be talking about the policies and practices of that administration in statements, not electioneering. I'll say it that way, not electioneering, where we're supporting or not supporting specific candidates. So with that said, let's get started. To our presentation and make sure we can. All right, here we go. So language access as a human right. We are standing, strategizing, and mobilizing in solidarity with Marylanders with limited English proficiency today. And really, folks with limited English proficiency across the country, because this presentation isn't just focused on Maryland. You've already heard about what our project is, but for people who came into the presentation after our lovely introduction from Kathleen, our Health and Benefits Equity Project, that's who's doing our presentation today, us. We advocate to protect and expand access to healthcare and safety net services in Maryland for low-income individuals. The policies and practices that we support are designed to eliminate those economic and racial inequities that we see in people being able to access healthcare and safety net services, because our ultimate goal is for every Marylander to be able to attain their highest level of health. So let's start with some key definitions for today's presentation. The first one is limited English proficiency. So if you're not familiar with language access, with limited English proficiency, we just wanted to give folks a quick primer. So limited English proficiency, when we use that word, or LEP, we're talking about someone whose primary language for communication isn't English. They may have a limited ability to read, write, speak, or understand English. It might not necessarily be in all of those categories though. So for example, someone could be proficient in English for certain types of communication, like speaking or understanding what's being said, but they might have limited English proficiency in other areas of their life. So that can include being able to read English or being able to write English. Next, language access, the broader topic, we're talking about providing language assistance services. So that includes oral language assistance, which could be in person, it can be remote. When we're talking about it in this context though, we're talking about being provided by someone who is qualified, trained to provide that service. So an interpreter, someone who is bilingual or a multilingual staff member who's qualified to communicate in another language and has those credentials. We're also talking about written translation. So that would be, when we talk about written language access, we're talking about translation. So that would be by a qualified translator. These are our last two key definitions as our primer. National origin, because you'll hear that near the beginning of this presentation. But when we say national origin, we're talking about someone's place of origin, or their ancestors, or the way someone manifests, a person's manifestation of their physical, cultural, or linguistic characteristics of a national group. So language is included in national origin. Interpretation and translation requirements. So I just wanted to give this quick overview. So when folks are receiving interpretation and translation, and I'll tell you in what settings, what context, what the requirements are to trigger these federal and state language access laws. But when interpretation and translation are provided, it has to be accurate, impartial, effective, and free of charge. You cannot charge people for interpretation and translation in the specific context that we're talking about. And I'll give more information on that now. So let's talk about the federal laws of the land. So we're talking about Title VI of the Civil Rights Act of 1964, and then Section 1557 of the Affordable Care Act. Both of these are federal civil rights laws that are anti-discrimination laws. So what they say essentially is that anyone who's receiving federal financial assistance, and federal financial assistance can come in a lot of different forms. It can be loans from the federal government, equipment from the federal government. It can also be accepting, if you're a healthcare provider, accepting Medicaid, certain parts of Medicare as payments for healthcare services, that can trigger these obligations as well. So even if only one part of your program or service receives even just $1 of federal funding, you would then be obligated to provide language access and to follow these laws. So as I was saying before, interpretation and translation have to be from qualified professionals or staff. And when we're talking about documents, we're talking about vital documents. And I'll talk a little bit more later about what's considered vital, but those have to be linguistically accessible as well. Just to go back a little bit to what I was saying earlier about non-discrimination laws. So both of these laws say that if you're accepting this federal funding, you cannot discriminate on the basis of a protected class. So sex, religion, disability, race, national origin. And national origin, like I said earlier, that's where we're getting the language access piece, people's primary and preferred language. Great. And actually, before we go to this, let me just touch on vital documents for a second again. So vital documents, when we use this word vital, what we're talking about is something that if a person with limited English proficiency received it and couldn't understand what was in it, or if it was misunderstood and it caused harm for them, that's what we would consider vital. So thinking about things that a state agency, a healthcare provider are required to provide by law, that's vital. Information on the status of your benefits from let's say like the Department of Human Services, information on what you need to provide in order to maintain your benefits or they'll be terminated by a certain date. That would be considered vital information as well. And Title VI of the Civil Rights Act is really what covers federal financial assistance recipients that aren't necessarily in the healthcare space. It also covers the healthcare space. But the reason that we have Section 1557 is because that specifically applies to certain healthcare settings. So in the healthcare setting, we're talking about things like intake forms, discharge instructions, treatment plans, medication instructions. Those need to be provided in the individual's primary and preferred language because they're considered vital documents. All right, so let's zero in on Maryland a little bit. I don't know why this image is so blurry, but let's zero in on Maryland. So for Maryland, we have our own language access statute. It's the Maryland Equal Access to Public Services - Individuals with Limited English Proficiency law. And it covers certain state departments, agencies, and programs. It requires them, just similar to the federal law, a lot of aspects of our law mirror the federal law. State agencies that are receiving funding, so state departments, agencies, programs, have to take reasonable steps to provide equal access to public services for individuals with limited English proficiency. So that includes providing interpretation and translation from a qualified interpreter or translator. Like I was saying before, vital documents have to be translated. And in Maryland, it's in languages that constitute 3% of the overall population of that state department, agency, or program's geographic service area. And that 3% is pulled from whatever the most recent census is for Maryland. We would like to lower that threshold in the future, and I'll talk more about efforts to try to do that in this new legislative session. And then as of last legislative session, so as of 2024, the state legislature, we advocates advocated for legislation to include principal departments. So these are sort of departments within larger agencies that weren't captured in the original language access law in Maryland because they didn't exist at the time. So now, if an entity has been created on or after October 2024, they have to follow this law as well. We want to make sure that we're capturing new agencies that are created. And in Maryland, several counties have their own language access laws, their own local laws and policies. Baltimore City is a great example. They have legislation in the works right now before the city government to strengthen their language access policy. Prince George's County also has its own language access policy that's pretty strong, and we can share resources on those at the end of this presentation. Great. I also wanted to give a spotlight on our Language Access Coalition that we have here at PJC, but we're going to be talking more about the kind of advocacy, education, and community outreach that we've been involved in over the last, really more than a decade now. So the Maryland Language Access Equity Alliance, it's a coalition that we've had for many years. It actually is a sister coalition to the Language Access Task Force, which Legal Aid, I don't know if we have folks from Legal Aid on here today because I can't see the chat, but if you're here, hi. Hey, sister coalition. They run the Language Access Task Force, sister coalition of this. This group, the Maryland Language Access Equity Alliance, used to be called the Governmental Access Work Group, so you might recognize that name. But we re-envisioned our name and logo this in the past couple months because we really wanted to highlight how our group, the goal of our group is to identify these systemic language access issues and to strategize and advocate to improve access to both public services and healthcare, while also uplifting and centering the voices of individuals with limited English proficiency in Maryland. So that's the inspiration for our logo and our name. And the next thing I'm going to talk about is a publication that we did, that we co-authored with Central Soul back in the end of 2022, so winter 2022. This was called Speaking the Language, the Right to Interpretation and Translation Services for Children and Adolescents with Mental Health Needs in Maryland. It's a mouthful, but I'll explain what it's about. So what this publication focuses on is the barriers to being able to access behavioral health services for children and adolescents in Maryland who are in immigrant families with limited English proficiency. So it might be the child themselves that has limited English proficiency or the parents or legal guardians that have limited English proficiency. And we have seen over the years a large number of behavioral health providers that even though they're receiving federal funding and they're required to follow federal language access laws, have been denying refusing to provide services to children with mental health needs because they or their parents or legal guardians don't speak English and would need an interpreter or translated documents. The most common reason we hear for that is the cost to interpret, to provide translated documents, which the federal laws, while they're while we do like federal laws, they don't come with a pot of money for entities that are required to follow them. So it's really up to that covered entity to build it into their budget. But we have done some advocacy in Maryland to try to ease the burden on behavioral health providers. We had a listening session with a lot of behavioral health providers as part of this report, and that's included in the report, which you can access online. We have links here, but we'll send them out at the end of the presentation as well. So this publication inspired legislation that we put forward last session with our partners at Central Soul to create a language assistance services pilot program in Maryland for behavioral health providers. What it does is it's a reimbursement program, essentially. It allows the Behavioral Health Administration to provide 3 grants to 3 local behavioral health authorities. So in Maryland, for folks who aren't from here, our behavioral health system is a little, not necessarily unique, but we have an overall behavioral health administration, and then each county has its own local behavioral health authority that's in charge of rendering behavioral health services there. So what this bill would do is give grants to 3 different, not bill, it's the law now, actually, it's the law. So what it would do, or what it does, is give 3 grants to 3 local behavioral health authorities. They're competitive grants, $60,000 over 2 years total, to essentially reimburse behavioral health providers who are tied to the public behavioral health system for their costs for interpretation and translation. I know some might see that as, oh, we're giving free money to providers, but really what this is to ease the burden on providers that are trying to comply with state and federal language access law, but are struggling because they don't have the resources to provide interpretation and translation. So in particular, trying to think what it's called, psychiatric rehabilitation programs or day programs, or residential rehabilitation programs, where the program might be 8 hours a day, or the person might be living at the program. If you have an individual that needs interpretation throughout the time that they're there, that can get very expensive, and medical interpreting is one of the more expensive types of interpreting because it's complex. So providers, when they apply to receive funds from these grants that the local behavioral health authorities have, they would be required to provide their language access plan. So that's another sort of accountability measure in place in this bill, is to make sure that providers have planned for how they're going to meet the needs of their service areas, of their communities that need behavioral health services. And so now we're focused on implementation advocacy. We've got a tight budget in Maryland. We're in a pretty severe deficit, and there have been cuts to the budget that we're still reviewing. The governor's proposed budget was released yesterday. So part of our implementation advocacy is likely going to be advocacy to protect the money that's been allocated for this program. And down the line, we'd love to do rights trainings and webinars for local behavioral health authorities, but also behavioral health providers, so they can better understand the obligations under state and federal language access laws, but also understand how to do things like develop a language access plan and assess the language access plan. And I'm going to pass things to David to talk more about our community outreach and education work.
Sure. So I wanted to highlight some of the more community engaged work that we've been doing as a project. We conduct monthly Know Your Rights sessions on language access rights for community members. We partnered with the Asylee Women Enterprise, which is a Baltimore-based organization that supports asylum seekers, survivors of human trafficking, and other forced migrants as they try to rebuild their lives in Maryland. So our goal with these trainings is to empower individuals with limited English proficiency to be able to identify rights violations and advocate for themselves, and also to know when to call us for help. So our training covers the right to interpretation and translation in medical settings, but we've been working on generalizing this training and covering more contexts and more places where people interact with the government at the request of participants. There's a real shortage of legal services providers who are working on these issues. So self-advocacy and helping people recognize rights violations when they occur is an essential part of our strategy. We want to be able to help community members to fight for themselves and know when to call us for help. My own personal background is in community organizing, so I always see relationship building with folks as a key sign of our success. We've had a lot of repeat attendees to these trainings who have come more than once to the same training. They've returned asking more pointed questions each time. And we've even had folks show interest in helping to conduct these trainings themselves and kind of go a little bit deeper. So we've also been working on conducting listening sessions with folks to keep our advocacy current, make sure that we're responding to the needs that are coming directly from impacted people. We've also been developing some self-advocacy tools. We have an I Speak card, which on one side identifies the person holding it as having limited English proficiency and being in need of interpretation and translation services and requests their provision. And on the other side has information in several different languages about your rights and how to contact Public Justice Center. So these are available right now in Spanish, French, and Arabic, which are the three languages that we've encountered the most frequently. And attendees have also been asking for multiple cards to hand out to their friends and in their own communities. So it seems to be a tool that people are really making use of. And we welcome people to use our card as a template for your own organizations. This is a really good tool that you can give out to people. It lets them communicate for themselves and assert their rights a little more easily and let them get in contact with help if those rights aren't respected. We've also been working on several Know Your Rights brochures. We've been updating those based on new federal regulations. So a new draft of this is going to be forthcoming that's more up to date. But we want to be able to provide information to the community about their rights to language access in healthcare settings. And with that, I think I'll pass it back to Ashley.
Great, thank you. Thanks for sharing that. And I also just wanted to shout out some of our partners that helped us develop this I Speak card. So that's Asylee Women's Enterprise and also Intercultural Counseling Connection. They were the ones who originally came to us asking us to do something like rights trainings for folks that are their clients, but also had asked, what kinds of self-advocacy tools could we develop, and had put this idea of having an I Speak card. Something that's, I think, unique about our I Speak card compared to some of the other ones that we've seen and we're inspired by as examples, is that we've also left a space on them for folks to put in their dialect, because Some languages have different dialects, and some of those dialects are very different from one another. And so ensuring that you have an interpreter who speaks your dialect is critical. There can be miscommunications. There can also be tensions between folks if they're not speaking the same dialect, and that might not be discovered until midway in a communication. So it's important that we know someone's dialect when we're trying to arrange interpretation for them. So let's move to our next slide. All right, so I'm going to talk about some exciting legislation coming in Maryland, being introduced in this current legislative session for folks who aren't from Maryland, because I know we had quite a few folks from an office in St. Louis sign up, so just wanted to shout them out. Thank you for coming. So this our state legislative session runs from January to about the second week of January to about the second week of April. It's 90 days. And it's underway right now, and it's very hectic. So this bill, it's a reintroduction. This is the bill's third year. It's sponsored by Delegate Gabriel Acevedo. He's from District 39 and represents Montgomery County. And what this bill would do, it's been pretty consistent over the years in what it would do, but we've made some changes because Maryland is in such a severe budget deficit, and we know that bills that have significant fiscal notes, and for folks who aren't familiar with sort of the legislative lingo, a fiscal note is just how much it would cost the state to implement the legislation that's being proposed. So we're trying to keep the fiscal note very low on this one, and I think language access is one of those issue areas where we work on it a piece at a time. So we want to get through critical measures that we can this year, and then in future years when the budget outlook is much brighter, put forward things that cost the state more money but are essential. So what this bill would do is, and it's still being drafted, so some of these things that I'm talking about today may change, but what it would do is require state agencies, departments, offices, the places I described before in Maryland, to establish a language access plan on or before 2028. The reason we pushed out that date is because of the budget deficit. We want to push it out to a time where we think the budget outlook will look much better so that we don't have a large fiscal note for this coming fiscal year. The other thing is a language access plan is actually not required on the federal level or in Maryland's law currently, but on the federal laws, places aren't required to have a language access plan. But it's the thing that when a federal agency is investigating a grantee, so someone who's received federal financial assistance, on whether or not they've engaged in national origin discrimination / denied interpretation and translation or language access generally, they're going to look to see, does that agency, does that entity, does that healthcare provider have a language access plan? Did you plan for how you are going to meet the needs of people who walk in or contact your office and need an interpreter or need documents translated? It's really critical that folks have these in place. We recommend them also for legal services organizations, really for any kind of organizations that have contact with the public, where you'd be encountering or possibly encountering people with limited English proficiency, to plan out how you're going to deal with that, how you're going to ensure that there's no communication barriers. We've got in our list of resources that we'll send out after the presentation a great guide from CMS and some other groups on how to create a language access plan and what to consider. This bill would also lower the threshold for translation of vital documents in Maryland. So right now we're sitting at 3%. So 3% of the total population of Maryland, if that language represents 3% of the total population, you have to translate those vital documents into that language. We want to lower that to 0.5%. The 3% from numbers run by some of our allies captures about 3 to 4 languages, but the 0.5% would capture closer to like 8 to 10 languages. And obviously, language populations change over time as we have an influx of different immigrant communities, folks who are refugees coming from other places to come to Maryland. The language populations may change. So we don't want to put specific languages in the state law. We just want to make sure that if they're within that percentage, that they're getting those documents translated. On the federal level, there are some I don't want to call them exceptions. They refer to, on the federal level, I'm talking about the Department of Justice, U.S. Department of Health and Human Services, other agencies that are responsible for, as the enforcement agency for the language access laws over their grantees. They refer to it as safe harbor protections. So there are some safe harbors around vital documents, for example, or around translation of vital documents. For example, if a language is one that is not written, then you don't need to translate it into writing because it's not a written language. There's also some allowances for if a language doesn't meet that percentage threshold to be able to do oral interpretation of the document for the person versus having a written document in their language. So I just wanted to flag that for folks. It would also lay the foundation to establish a monitoring, oversight, and investigation and enforcement body for Maryland's language access law, as well as a body that could give technical assistance to state agencies in creating their language access plan. We're still trying to identify where this could be housed within an agency office department in Maryland that could really take on this role and do a a strong, great job of being all four of these things plus providing technical assistance. And we want to ensure also that that agency has the knowledge that it needs to be able to do this. So not only knowledge about Maryland's immigrant community, but also knowledge about Maryland's disability community, right? Because limited English proficiency, there's often a not misunderstanding, but a thought that when we're thinking of limited English proficiency, we're only thinking about people who are speaking foreign languages, people who are part of, who are foreign born, part of an immigrant population, but it also includes individuals who need access to sign language services. So people with disabilities, and sometimes those two communities overlap, where we have individuals who speak Spanish, whose primary and preferred language is Spanish, but they need access to a Spanish language interpreter. So we want to make sure that wherever this is housed, the enforcement, all these roles, wherever that's housed, that that agency is able to serve both communities, either on its own or with technical assistance and consultation from agencies in Maryland that oversee disability rights and immigrant affairs / rights. So go to the next slide. So now is where we get into our conversation about what can we expect with the incoming federal administration, the Trump administration. So just as brief background, we're not totally in the dark on what to expect from the incoming administration. I want to be very careful not to, make this a space where we're raising people's anxiety on, okay, well, this and this and this could happen without having some history and context to, kind of look at that crystal ball. So we do have some history. When Trump was in office previously, he did roll back critical language access protections in the healthcare space. So in Section 1557 of the Affordable Care Act, we also just very recently, within the last 6 or so months, the Biden administration restored a lot of those protections through the regulations, restored a lot of those protections, and added some new protections that we haven't seen before. So this list is really some things that we saw that Trump had rolled back, that his administration had rolled back, but also some things that we think, because the Biden administration had put into place, might be rolled back as well under the incoming administration. So before I get into this list, I just want to play this clip. Just trigger warning, I know, it can be hard for folks depending on where your political leanings are. And again, we do not do electioneering as an organization. We can't support or we can't endorse or not endorse particular candidates. I just wanted to acknowledge that I know that words can cause harm, and just issue a trigger warning on what's being said in this clip. But last night I was doing some research, because typically when you type in, president's name, and particularly Trump, you type in Trump and then really any subject area, you can typically find something that he has said on that subject area. So I was curious if he's ever said anything about language access, and this is a clip that I found. Again, it's not the full clip, but just a little bit of it. So I'm going to play this.
Nobody's really been able to tell me how anybody could want it. You know, you're always in business. You always want to understand the other side. You want to figure it out so you can do something that's good or bad, depending on what you're looking for. But nobody can explain to me, because everybody I speak to says how horrible it is. Nobody can explain to me how allowing millions of people from places unknown, from countries unknown, who don't speak languages. We have languages coming into our country. We have nobody that even speaks those languages. They're truly foreign languages. Nobody speaks them. And they're pouring into our country, and they're bringing with them tremendous problems, including medical problems.
So just going to pause for a moment, because I know that, like I said, words can cause harm. And I just want to give folks a moment to take a breath, and then we can kind of analyze what was there, because that's what we can do as a 501c3. We can analyze this, we can critique it, and we can, talk about how do we prepare for what may come from the incoming administration by preserving some of these rights on the state level, right? So just wanted to flag a couple things there. From my perspective, we have people who speak many languages in the United States, right? The US is a very language diverse country. Maryland is a very language diverse state. And so the idea that we have folks coming in that speak languages that no one else speaks, I don't believe that's true. I think that more so I guess I'm doing a little bit of fact checking, more so we might have a shortage of interpreters for certain languages. I know even just for our organization, there are times where we have long wait times for lesser spoken languages that we encounter. And I don't think I said this, our organization has its own language access plan. We also now have a language access committee that's focusing on improving how we interact with the public and how we ensure that we're providing interpretation, translation, and meaningful access to our services. So I'll say that piece. The other thing is that because we have an interpreter shortage, that prompts in my mind some thoughts on how do we incentivize folks to become interpreters? How do we, take our youth who may be bilingual, and children learn languages very, very quickly. How do we train up our youth to be able to act as interpreters in the future, to take jobs where interpretation will be required, to be in spaces where bilingual, multilingual, what is the other word, polyglot, when we speak many, many languages, spaces where many languages are coming in, and be proficient in being able to interpret or to do document translation. So before we jump into our brainstorming session, I just want to share some of the things that are at risk of rollback, at least from our perspective, based on history, but also based on what was recently put into place in the Affordable Care Act language access provisions. So notice requirements for free language assistance services and the non-discrimination notices. Under the Trump administration, those were struck from the federal, Section 1557, and the Biden administration recently restored that. Also removing certain federal financial assistance sources as a trigger for language access obligations. So you heard me talk about before, federal financial assistance, the definition is very broad. It includes loans. It can also include things like Medicaid and Medicare payments. More recently, so within the last few months, for the longest time, Medicare Part B was not part of Section 1557 in triggering the requirement to provide language access. Now it is. So that's at risk of being rolled back too. There are also some new telehealth protections for language access that were included under the Trump administration. They had changed the standards around remote interpreting around the visual quality of remote interpreting. So that could be at risk. Having a grievance process through the entity, agency, healthcare provider that the person with limited English proficiency is communicating with, being able to have a process where they can file a complaint in-house, that's at risk as well. We did see under the Trump administration rolling back of things like having a language access, sort of like a language access coordinator. Not necessarily the grievance process, but having a coordinator. And that's really essential to being able to have an effective grievance process. And lastly, relaxing guardrails around the use of AI and other tools. So I am not savvy on AI. I'm not knowledgeable enough to explain all of the intricacies of AI, how it works. But the Biden administration did in the new Section 1557 regulations include some language to create some guardrails on when AI, predictive models, other tools that help entities predict and determine what services they need to provide, but also communications, put some guardrails on how that can be used. And essentially it's that they can't be used in a discriminatory way. And if it's discovered that, you know, the AI, that whatever tools are being used are having a discriminatory effect, then they have to mitigate that. So we think that that could possibly be rolled back under the incoming administration. So that is actually the end of our PowerPoint presentation.